Dora Nkem Akunyili was a pharmacist and governmental administrator who gained international recognition and won several awards for her work in pharmacology, public health and human rights, and also the Director General of National Agency for Food and Drug Administration and Control, NAFDAC, in Nigeria from 2001 to 2008. Dora Idemobi, born in Makurdi, Benue State, Nigeria, on the 14th of July 1954, to Chief Paul Young Idemobi, who hailed from Nanka, Anambra State, received her first school leaving certificate from St. Patrick's Primary School, Isofia, Anambra State, in 1966, and had a West African School Certificate examination at the Queen of the Rosary Secondary School in Nsukka, Enugu State, in 1973, where she graduated with Grade 1 distinction and won the Eastern Nigerian Government Post-Primary Scholarship and the Federal Government of Nigeria Undergraduate Scholarship. She went on to study pharmacy at the University of Nigeria, UNN, graduating in 1978 and received her PhD in ethnopharmacology in 1985. She served on several state government boards and then was named Supervisory Councillor for Agriculture in a local government unit in Anambra State. She worked as a hospital pharmacist in the University of Nigeria Teaching Hospital, UNTH, in Enugu State. In 1981, she became a graduate assistant in the Faculty of Pharmaceutical Sciences, UNN, while in 1990, she was a senior lecturer, and in 1996, she was made a consultant pharmacologist at the College of Medicine. In 1996, Akunyili became Zonal Secretary of the Petroleum Specialist Trust Fund, PTF, coordinating projects funded by profits from oil in Nigerian southeastern states. In 2001, President Olusegun Obasanjo appointed her the Director General of the National Agency for Food and Drug Administration and Control, NAFDAC. She was appointed NAFDAC DG in 2001 and served till 2009. At the time of her appointment to the NAFDAC, Akunyili was confronted with the health system ridden with corruption. NAFDAC had a qualified but poorly trained staff, overwhelmed with enormous tax regulating food and drugs in Nigeria. Many engaged in unethical practices such as demanding bribes, unnecessarily delaying inspection and registration of goods, and aiding and abetting official misconduct. Akunyili had a special motivation for attacking the country's counterfeit drug problem, and this is because in 1988 she had watched her sister, aged 21, died after being given injection of fake insulin as part of a regular diabetes treatment. She put together a team of mostly female pharmacists and inspectors and started a war against counterfeit drugs that saw many open-air medicine markets across the country closed down, including one in Kano State after her officers confiscated £140,000 worth of fake drugs. The agency, under her leadership, broadcast jingles on radios and television to make the public aware of the dangers of substandard drugs and to encourage people to report suspicious drugs while also publishing lists of counterfeit products regularly in the newspapers. Local manufacturing facilities were not strictly monitored, and some utilized poor manufacturing practices that resulted in the production of poor quality or contaminated products. Akunyili also encountered ill-equipped or obsolete laboratories and offices. In July 2003, the International Children's Heart Foundation visited Nigeria to operate on sick children at a teaching hospital in Enugu. After 4 children died in what appeared to be a case of counterfeit medical supplies, and despite being confronted with what seemed to be a hospital cover-up, Akunyili confiscated supplies and found fake adrenaline, fake muscle relaxants, and infected intravenous drips. As of 2006, she was reported to have secured convictions of 45 counterfeiters, with 56 cases pending. Her efforts led to increased public awareness about counterfeit drugs and more direct and purposeful surveillance at Nigerian customs. As National Director of NAFDAC, Akunyili was exposed to this dark side of regulatory apparatus. When attempts to bribe her failed, profiteers resorted to blackmail, intimidation, harassment, and threats. They dropped fetish objects in her office, which included tortoise, blood-stained feathers, and African beads. They made threatening phone calls to her and her husband. They even resorted to attacking and, in some cases, burning down NAFDAC facilities. Akunyili herself faced multiple assassination attempts, narrowly escaping death when a bullet fired at her car barely missed her. And NAFDAC staff members face intimidation, harassment, and assault. After 2 years of service to run for office as Senator representing Anambra Central in National Assembly in 2008, Akunyili secured the position of Minister of Information and Communication through an appointment by the current government. She resigned her appointment as Minister of Information and Communication on December 16, 2010 and ran for election as Senator for Anambra Central for APGA in April 2011, but was defeated by Chris Ngige of the ACN. She immediately sent a petition to the Independent National Electoral Commission disputing the result. Akunyili received over 900 awards throughout her career, the highest number of awards ever received by any Nigerian. History Val reports that over 100 awards were later discovered in her boxes. In 2012, her book, The War Against Counterfeit Medicine, My Story, was published. She was married to Chike Akunyili, a medical doctor, and they had 6 children. On 28 September 2021, her husband Chike Akunyili was killed by gunmen at Mpo in the Idemili North local government area of Anambra on his way back from an event to honor his late wife at Sharon Hall, All Saint Cathedral, Onitsha. Akunyili died at a specialist cancer hospital in India on 7th June 2014 after a 2-year battle with uterine cancer. Her funeral took place on 27th and 28th August, attended by many dignitaries from within Nigeria and beyond. Akunyili was laid to rest at Agudu in Anambra State. Akunyili demonstrated that a woman, a black woman, could lead exceptionally where most men had woefully failed, despite operating within a highly patriarchal society. Akunyili's performance has proven that black women should not be taken for granted when it comes to handling the mantle of leadership, and that national development is not tied to a leader's gender, but rather just skills, knowledge, wisdom, and courage.